Research shows that the school environment is critical for fostering academic motivation and social development in children.
Dr. Emily Mudd is a pediatric psychologist at Cleveland Clinic Children's. We talked about fears some children may have about getting back into the classroom.
So what is it going to be like the next time I'm in a big crowd? Children, it's really important that they're similar to their peers. So maybe their families had different rules during the pandemic on levels of safety. So how do you address those conversations in school? Children with a lot of anxiety obviously will be struggling a lot more with the return to school. What will it be like seeing peers again? What will it be like, wearing a mask at school and things like that? Children have missed out on a lot over the past year. Into a pandemic, we have missed proms, we've missed sporting events, social activities, just being with friends in general, and all of that being very, very, very important to children. And so acknowledging that is going to be really important before we return to the new normal back in school this year. Having those conversations about anxiety, giving space for your child to talk about what they're anxious about. And then there's the concrete things we can do. So sleep is huge, getting your children back on a schedule. A lot of kids are going to bed later, sleeping in later in the morning. So once we return to in-person schooling, that's going to be more challenging to do. Getting them more on a schedule will be really important, and really giving them space to talk about what will be different, especially for younger children. So although they might be used to washing their hands and social distancing, what does that look like in the school setting? So there may be a temperature check at the door. You'll be required to wear your mask. You may have smaller lunch periods, things like this. You'll have to socially distance at recess. It's going to be really important to break that down, especially for younger children who may not generalize that what we've been doing at home, we also have to do at school. Always prepare, prepare, prepare. So telling your child, if you help prepare them for what could happen. So for example, in the past, I know you could go to baseball if you had a cold. This year, if you have a cold, you're not going to be able to go to baseball. So that kind of prepares them and can prohibit a breakdown later of big emotions. So anything that we can tell them for gives them more power and decreases their anxiety for returning to school, returning to any social event, but still gives them the opportunity to have those really important interactions. There are families where there is no option but to stay home. Maybe there's a vulnerable family in the household, maybe the child themselves is vulnerable. So for those families, they have to make the decision based on what it is right for their family. But generally speaking, most children, we know the best place for them is to be in-person learning. We have seen mental health diagnoses in children increase this year. So specifically thinking about anxiety and depression, we've seen a lot more in children. And so is this a result of, not being in school, not being around friends? It's certainly a combination of all the above, I think.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.